muscles of the temporomandibular joint. First one, mouth opening. First one, mouth opening. Second one, mouth closing. If you see mouth opening, here mouth opening is nothing but the mandibular depression. Mouth opening is nothing but the mandibular depression. When the depression is happening, which muscle is going to helpful for this? Digastric muscle. The muscle name is digastric. Digastric muscle is going to helpful in the mouth opening. So here this is the hyoid bone. This is the hyoid bone. So here we will be having anterior digastric muscle. This is the posterior digastric muscle. This is the posterior digastric muscle. So the digastric muscle is going to helpful for the mouth opening. So if the muscle is pulling like this, the mouth will open. The mandible means the mouth will open. This is the muscle. If we see mouth closing like mandibular elevation, which muscle will helpful here? First one, temporalis muscle, and second one, masseter muscle. Third one, medial pterygoid muscle. So these muscles are going to helpful for the mouth closing, mean mandibular elevation. So first muscle is the temporalis. Here this is our temporal bone. So temporalis muscle will be here. This is our temporalis muscle. This muscle is going to helpful for the mouth closing. At the same time, the masseter muscle, which is present here. From this is zygomatic bone, this is maxilla, this is zygomatic bone. From zygomatic to the mandible, masseter muscle will be like this. So that the masseter muscle also going to helpful for the mouth closing. And one more, medial pterygoid muscle. The medial pterygoid muscle is going to present between here. This is the medial pterygoid muscle. This is the temporal muscle. This is the masseter muscle. So these three muscles are going to helpful for the mouth closing, that is elevation. And if we see the third movement, that is mandibular protrusion. The mandibular protrusion is going to happen through the bilateral. Bilateral means both sides. Bilateral action of the masseter muscle. And at the same time lateral pterygoid muscle and medial pterygoid muscle. And we are saying this is the masseter muscle, this is the medial pterygoid muscle. Lateral pterygoid muscle will be present above the medial pterygoid. This is lateral pterygoid muscle. So this masseter, medial, lateral pterygoid muscles are going to helpful for the mandibular protrusion movement. And one more movement here we are having, fourth one, mandibular retrusion movement. This movement is going to happen through the action of the muscles. The muscles are the bilateral action of the posterior fibers of the temporal muscles with assistance from the digastric muscle. So that here the retrusion movement, what will happen? It is going to happen through the posterior. See, these are the posterior fibers. The posterior fibers of the bilateral means right side and left side. Posterior fibers of the temporal muscle. At the same time digastric. See, here we are having posterior digastric, anterior digastric. Here posterior digastric will involve more. So here posterior fibers of the temporal muscle and posterior digastric muscle. These two muscles are helpful for the retrusion movement of the mandible. And the last movement, fifth movement, that is the side by side movement. That means chin will move to right side and left side. This movement is going to done by the muscles. That is lateral pterygoid muscles and medial pterygoid muscles and temporalis muscles. So this lateral pterygoid muscle, medial pterygoid muscle and temporalis muscle. These three muscles are going to helpful for the chin. Suppose if you take the chin right side or left side, it will move. So these are the muscles of the TMJ joint for the movements. Here we didn't discuss about the muscles of the mastication, what is the origin, what is the insertion. These are all we didn't discuss. What is the nerve supply, what is the blood supply. These are all we didn't discuss. Just we discuss what are the muscles which are responsible for the which movements of the mandible.